Hi, I'm Dr. Chanda Miles and I'm the boarded veterinary dentist at Gulf Coast Veterinary Specialists. I'd like to give you a quick recap of a few points that were discussed in my lecture of common oral pathology. First, I strongly recommend that you institute a charting program for all of your patients. It will take you less than 5 minutes to perform and can be invaluable for your treatment plan and record keeping. I'll be giving a lecture on how to perform an appropriate oral exam and charting at the GCVS Symposium this August if you're interested as well. Second, it's very important to utilize intraoral dental radiography if you're going to perform dentistry. Not only will it help you formulate a proper treatment plan for your patient, but will assist you in getting out of some tricky dental situations such as broken roots. I recommend that any sort of pathology be radiographed, even if it seems small or seems inconvenient. Once you and your staff become more proficient at this, it will become customary to obtain a full mouth series for every patient. Okay. So let's talk briefly about a few of the highlights of the more common things that you're going to see regularly in your patients' mouths and what to do about them. First, intrinsically stained teeth. These are discolored teeth that have a pink, purple, or gray hue to them. About 92% of these teeth are deemed non-vital. Root canal therapy or extraction is the recommended treatment. Enamel defects. These are commonly seen in our younger patients. These defects are usually a result of some sort of febrile event when they were younger and when the enamel was developing. Pets that are affected are often uncomfortable, so much because of the exposed dentin that's present. These defects should be treated by removing any remaining diseased enamel and receiving sealant over the exposed dentin. Fractures are one of the most common things our patients acquire, and depending on whether the pulp is exposed or not, determine the recommended treatment. If there is pulp exposure, these teeth must be either extracted or receive root canal therapy. They cannot be monitored. If there's no pulp exposure, take a radiograph to confirm there's no pulp or root disease, and these teeth usually can be left alone or sometimes have a sealant placed on the exposed dentin. Periodontal disease is another extremely common situation that you will see in your patients. This is where your oral exam and charting and radiographs will be worth their weight in gold. Both of these will help you compile a treatment plan for every tooth. I discuss the potential treatments and show radiographs for each of these stages. Tooth resorption affects about 60 to 70% of cats and can be very painful. Extraction or crown amputation is the treatment of choice right now as we still are not sure of the cause. Radiography is absolutely crucial in treatment of these teeth to help decipher whether a tooth should be crown amputated or surgically extracted. Gingival enlargement, also known as gingival hyperplasia, can be present from a patient being medicated with calcium channel blockers or cyclosporin, or certain breeds are predisposed to gingival enlargement such as boxers, pugs, and Great Danes. Resection is recommended to prevent pseudopockets, which can usually lead to periodontal disease. If you only see gingival enlargement in one area of the mouth, I recommend submitting the tissue for histopathology to rule out any other benign gingival tumor. Lastly, oral tumors are unfortunately a common occurrence as well. As you know, they can be either benign or malignant with many shades of gray in between. The key is to biopsy and perform surgical resection if needed. Although you may refer to an oral surgeon for treatment, you are the first defense in recognizing that they are present and instituting treatment immediately for a chance at the best outcome. Thanks for tuning in. For more information, you can visit our website at www.gcvs.com for any information on dentistry and oral surgery or any of our other 15 departments.